Hello, and welcome to the Pain, Truth, and Nothing But 20-question quiz. The only purpose of the short quiz is to help those coping with persistent pain better understand why pain sometimes persists. The answers and references to this quiz are based on the book and videos, The Pain, Truth, and Nothing But. So let's begin. Question 1. We experience pain only if there's actual physical injury to the body. Is this true or false? It's false. Pain can be present with no tissue damage. In fact, up to 70% of all those who lose a part of their body or have an amputation feel sensations such as burning or severe pain in their no longer existing hand, leg, or breast. This is referred to as phantom limb pain, and the pain is real. Therefore, pain can be present with no tissue damage at all, even when there's no leg present. And the theoretical basis behind this is that our brains have a map of our body encoded in there. So even if the part of the body is not there or it's not injured, the brain can still perceive the pain. Question 2. Pain always means that there is something injured or damaged in the body. This is false. Headaches can be quite painful, yet in the vast majority of cases, nothing is injured or damaged. Calf cramps can be very painful, yet nothing is injured or damaged. There are hundreds of other examples, but 2 will do for now. Question 3. Persistent pain always means that the injured tissues have not yet healed. Is this true or false? It's false. The fact is that tissues heal. Broken bones, torn ligaments, muscles, and tendons most often heal within 4 to 6 weeks. Pain lasting longer than 3 months is unlikely from just tissues, especially if the pain is aggravated by relatively light activities or present even at rest. An excellent example to prove the point that tissues heal is looking at one of the most common orthopedic surgeries done, which is the total hip replacement. In this scenario, orthopedic surgeons do surgery on usually senior populations, such as an 80-year-old person, and they make a large incision on the skin, and they cut through the muscles, they cut through the fat, they cut through all the tendons and ligaments, and then they get to the bone, and they use all kinds of tools such as hammers and chisels and screwdrivers, and they insert plates and screws and metal rods into the femur, which is the largest bone into the body, and they pour cement into it to lock that into the bone, and then they suture back up the ligaments that have been torn and the tendons that have been torn. They suture back up the muscles. This is considered a relatively traumatic event where all these tissues are cut, and yet the amazing thing is after this surgery, 3 months later, they're playing golf again. Many have actually zero pain. This is to prove the point, even after a major trauma that causes injury to the muscles, bones, tendons, and the skin, tissues heal, even in an 80-year-old person. Question 4. Ignoring pain and quickly getting back to full activity is a good method of dealing with persistent pain. False. Ignoring pain often leads to the nervous system becoming even more protective and have you experience more pain the next time you attempt the activity. Ignoring pain or simply taking pain medications to numb the pain and overdoing activities is a bad idea. I don't recommend patients to run and ignore their pain. If you've recently injured your back, we don't recommend that you lift heavy boxes and just ignore the back pain. If you've recently hurt your neck or your shoulder, it's not recommended that you vacuum the entire house for 2 hours. Question 5. All pain is real. There's no such thing as imagined pain. That is true. All pain is 100% real. There's no such thing as imagined pain. If you feel it, it's real. When somebody has a headache, is it imagined or is it real? Of course it's real. If it's experienced, if it's perceived, it's real. When somebody has muscle tension or spasm in their neck because of pain or because of any reason, is it imagined or is it real? Of course it's real. when somebody has increased heart rate or has heart palpitation? Is it imagined or is it real? Of course it's real. All these physiological responses are 100% real. And don't let anyone make you believe that it's imagined. Question 6. It's possible to feel pain and have no physical injury or damage to the body. That is true. The nervous system can experience pain even if it simply perceives potential injury or damage. There are thousands of pain experiments where healthy people are fooled into believing that they will be experiencing pain, and they actually do. They experience pain. For example, people are told to put their hands on a hot stove and the stovetop is red, but it's actually cold, and they perceive burning. Or people are told to take certain medications that may have side effects of joint pain or muscle pain, and they experience joint pain or muscle pain, even if the medication is not real and is placebo. And the greatest experiment that demonstrates how our brain can experience things that are untrue is this optical illusion. In the checkered shadow illusion, square A appears darker than B, but they're the same color. Let me demonstrate this by covering up the entire image except box A and B. As you can see, your brain is experiencing that they're the same color right now. However, as I gradually take the covers away, your brain now realizes, wait a minute, this could be a checkered pattern. So probably B is lighter than A. And as I take another box away, your brain is saying it's definitely a checkered pattern. Therefore, box B is lighter than A. And as I take everything away, your brain says most definitely B is lighter than A. And this is exaggerated by the green cylinder that appears to cast a shadow over the checkered box. So the brain says box B must be darker because there's a shadow over it. However, I'm going to perceive it as lighter because that would make logical sense. This is absolutely amazing, because if I cover everything up immediately again, you'll see that A and B are the same shade. When I take them away, they instantly become different colors. This is based on our brain perceiving things based on our past experience and knowledge. Question 7. Pain is an alarm system that warns the body of actual or perceived danger. This is true. The nervous system simply has to perceive possible danger, and it makes us experience pain. Please do this experiment with me. I would like you to take your index finger backwards until you feel a stretch. Only do this experiment if you have not injured your finger before. So now you feel a stretch. I'd like you to take it further back until you feel some discomfort and pain. Okay, you can let it go now. Now bend your finger back and forth a few times. I'm going to ask you a question. Did you actually break a bone? No. Did you tear a muscle? No. Did you sprain a ligament? No. So why did you feel pain? The brain says, you idiot, stop doing this or else you're going to hurt yourself. So the brain has you experience pain in order to have you stop before you actually hurt yourself. The nervous system is amazing. Here's another example of how our brains can misinterpret signals. These lines are definitely straight. Yet even though I've told you this and I can prove it to you, still your brain can't help but perceive the lines as being crooked. See, the lines are straight. Sometimes our brain stacks up beliefs, experiences, and memories in a particular way and automatically perceives our body as being damaged or crooked, when in fact there is no damage and nothing is actually out of alignment. If the brain believes the body is still injured, no matter how much you're told otherwise, the pain can persist. But don't worry, there's a way to reprogram the brain. Question 8. All pain is in the head or in the brain. That is true. All pain is experienced in the brain, the nervous system, and in fact every cell in the body. People can feel leg pain even if the leg is no longer there. But to joke about it, nobody can feel pain if the brain is no longer there. In fact, scientists are now discovering that memories, emotions, and feelings may not just be in the brain, they may also be experienced in the heart and in the gut. The skin, muscle, tendons, bones, do not and cannot produce pain. They can only produce danger messages. The brain and the nervous system decide if the danger messages are worthy of pain. We don't see with our eyes. Our eyes simply allow light to enter. Our brain translates all light images and gives them meaning based on our past experiences. We don't hear with our ears. Our ears simply pick up vibrations. Our brain translates those vibrations into meaningful words based on our past experiences, such as the language we've learned. We do not feel pain in our body parts. They simply fire danger messages if they feel threatened. Once again, our brain translates those messages either into pain or no pain in order to protect us. Question 9. Thoughts and fears can increase blood pressure, breathing, heart rate, muscle tension, and spasms. And that is true. When you're angry or something is frustrating you, muscle tension can occur. When somebody's been in a car accident, muscle tension occurs, breathing rate goes up, heart rate goes up, and you may even get muscle spasm. Even days after the accident, when you think about the accident, it can produce increased blood pressure, increased breathing, increased heart rate, and muscle tension and spasms. Thoughts and fears can cause or increase swelling or inflammation. And that is true. They do studies where they take people with, for example, rheumatoid arthritis, and they have them visualize opening a jar. And just by this visualization, they have increased swelling in their hands. Question 11. Just thoughts and fears can actually cause or increase pain. And that is true. Many people with persistent pain report that their pain worsens when they have to deal with their insurance company, workers' compensation, or their mother-in-law. The vast majority of disc degenerative changes, referred to as arthritis sometimes, and disc bulges seen on X-rays and MRIs are normal and are not associated with pain. And that is true. Here are the facts. 98% of individuals who have no neck pain have degenerative changes in their necks. 70% of those with no back pain have disc bulges present on their MRI. And 50% of those with no shoulder pain can have torn rotator cuffs. So take these radiological findings with a grain of salt. Often they do nothing but add fear and anxiety to patients who are experiencing pain. Question 13. Increased nervous system hypersensitivity may explain why sometimes pain persists even after injured tissues have healed. And that is true. There are now hundreds of medical studies published by pain researchers internationally that support this concept of nervous system hypersensitivity. Question 14. Emotional stresses such as depression, anxiety, fear, or anger can increase nervous system hypersensitivity and contribute to persistent pain. And that is true. Emotions can increase pain. In fact, depression, anxiety, stress, anger, perceived injustice, and fears of re-injury can all increase nervous system hypersensitivity and contribute to persistent pain. Question 15. The spinal cord and the brain can magnify pain as long as the brain believes the body is in danger. And that is true. Question 16. Reliance on passive treatments such as pills, massage, tingly machines, and adjustments may be okay in the short term, but not in the long term. It's actually true. Taking pain medications such as opioids after surgery may be okay, but taking it in the long term, they actually may increase dependence on the medication and increase the pain sensations. Using tingling machines may be okay in the short term, but relying on passive devices may contribute to the belief that there's something injured that must be fixed. Relying on manual therapy techniques provided by different healthcare providers may provide relief in the short term, but in the long term may be increasing your pain perception, and it's informing your brain and your body that something is injured and somebody else must fix it for me. That mentality can be a contributing factor to persistent pain. Question 17. Understanding and truly accepting that pain does not always mean harm is the best way of very gradually returning to normal life activities. True. The goal is to very gradually return to running or sports or any activity that you wanted to do, and not ignoring pain, but listening to the pain and understanding that the pain may not be caused by tissue damage. Gradually returning to lifting heavy boxes, and gradually vacuuming the house, and pacing self, starting with vacuuming only one room. That is the secret to recovery, and this is referred to as graded exposure. It's impossible to recover from persistent pain without a daily active exercise or movement program. That is true. The fact is that nervous system hypersensitivity is often made worse by prolonged rest. Use it or lose it, but motion is lotion. The brain literally changes when we stop normal movement of a body part for a long period of time. Attempting regular movements and exercising on a daily basis are essential for managing persistent pain and changing the brain. This is referred to as neuroplasticity. And the movement program can be anything that you enjoy. It can be yoga, it can be tai chi, it can be aqua fitness and pool exercises. It can be stationary cycling or cycling outdoors. It can be gardening if you enjoy gardening. It can be pole walking or regular walking. It's even better if it's done with a group and you socialize at the same time. It's even better if it's done outdoors. The minimum recommended dosage for walking or pole walking is 30 minutes per day, 5 days a week. You may say, I can't walk for 30 minutes. Then it's just as effective to do 10 minutes, but 3 times a day. Or if you can't do 10 minutes, then 5 minutes, 6 times a day. Again, the goal is to do some form of physical activity every day. And that can be strengthening exercises that have been prescribed to you by your physical therapist. Question 19. It's possible to teach the brain to learn how to change pain perception, as the nervous system and the brain are always changing. And that is true. Remember the homunculus that we spoke about, which is the body map that's encoded in the brain? That's constantly changing based on how we use it or not use it. Finally, question 20. To reverse pain from hypersensitive nerves, our body needs ample oxygen, water, fresh fruits and vegetables, sleep, vitamin D, sun, joy, and pleasure. And that is true. We need oxygen, and the best way to get oxygen into the body is by moving and exercising. That includes walking, swimming, aqua fitness, cycling, anything that you enjoy. The body needs water. How much water is up to you? The only thing that's recommended that you limit your intake of caffeine, colas, and high sugary drinks such as fruit juices, as they tend to increase nervous system hypersensitivity. Fresh fruits and vegetables are recommended, and limiting the amount of processed food or high sugary foods. If you have diabetes or have weight issues, I strongly suggest that you consult a registered dietitian. Sleep is essential for recovery, as the nervous system requires rest in order to get better. Vitamin D and sun, we must spend time outdoors. It doesn't matter early in the morning or in midday or in the afternoon. Just being outdoors is beneficial to the nervous system. Finally, joy and pleasure. And that is one of the main focuses of the Pain Truth program, to add small joys and pleasures into your life in order to reduce nervous system hypersensitivity. Did you get 20 out of 20 in this quiz? If not, simply view this video again. If you found this Pain Truth quiz valuable, please continue to view the Pain Truth and Nothing But videos on YouTube. The first video is 10 minutes long. The second video is 20 minutes long, and the third video is 21 minutes. I look forward to speaking with you again.